Welcome, I'm Chris Fleming.
I'm Rob Lott, and you're listening to Health Affairs This Week.
So, Rob, today I thought maybe we talk a little bit about telehealth, and that's obviously been a subject that's been in the news a lot lately. And I'm curious, without probing too much, a lot of folks have had an experience with telehealth for the first time during the pandemic, and I wondered if you were one of them, and if you'd maybe talk a little bit about your own experience with the subject.
Yeah, this last year was definitely the first time I've been able to take advantage of a telehealth visit, and it was a strange experience. I think it was a little awkward for both me and the doctor, who are both used to, meeting in that small, tiny room, and to have the sort of screen in between us was a little strange, and for both of us, I think. But it was a necessary intervention in terms of the platform we were using to connect. And at the end of the day, I was able to, get a diagnosis and some help from the clinician, and left the encounter, better off than when I started. So, all in all, it was a pretty positive experience, and it seems like that's the feedback I've been hearing from other people about their experiences as well. Obviously, it's not ideal, but it's been a new experience for a lot of people.
Well, I'm glad it worked out for you. I can't claim on my own part to have had personal experience. I did have a little bit of a interesting experience where my wife and I tried to help some elderly friends with a telehealth experience, and they were having none of it. It's like, we're going to see the doctor in person, or we're not going to see the doctor at all. So,
Yeah, so obviously our experiences are our own, but I think there are, likely a few data points in what has been a profound trend over the last year. Earlier this week, we published a package of 5 articles on Health Affairs blog, in which the authors all raised and tried to answer some big questions about the future of telehealth. And so, what was the sort of the before times version of telehealth? How did it look before COVID-19 arrived and changed everything?
well, prior to COVID-19, as you say, which pretty much changed everything. The use of telehealth, it was there in the US, but it was relatively limited. There were a lot of payment restrictions as compared to in-person visits. There were certainly a lot of site restrictions where programs like Medicare would only reimburse for certain instances if someone was in a rural area, or even then if they were at certain sites that were deemed eligible. So it was a relatively limited enterprise.
Okay, so then COVID arrives. What happened at that point?
Well, I mean, basically, it exploded. A little bit out of necessity. I mean, it's people have talked about 20 years of evolution in 20 days. Essentially, the pandemic greatly increased the use of virtual physician visits because no one could go, or meant it was very hard to go in person. For instance, in one of the blog posts that you mentioned, Francis, who Jay Crossan, as everybody knows him, was a longtime Kaiser Permanente executive, former MedPAC chair. He cited an estimate that televisits during 2020 were up by 50%, and that 20% of all physician office visits during 2020 will have been televisits.
Wow. So some of this was out of necessity, right? Physicians closed their offices, hospitals canceled elective procedures. And so all of these providers had to pivot dramatically.
What also happened was that policymakers, through legislation, through regulation, relaxed some of those restrictions that we were talking about earlier. Very importantly, they established payment parity, where you would get paid as a provider the same amount for a telehealth visit as you would for an in-person visit.
Yeah, it was actually pretty impressive. I might even say surprising how quickly these behemoth institutions were able to make a change. And so now, as we begin to see the end of COVID-19 and the public health emergency, the debate over how to structure telehealth going forward is beginning. This is really maybe a bit of a hinge point, I think. Is this just a blip or the start of something new? Will we go back to the way things were? Or is that even an option?
Yeah, that's right, Rob. I mean, Crossan, who we were talking about earlier, in his blog post refers to the coming conflict over televisits in the title. Some observers, he notes, like MedPAC, who obviously they have a very important opinion here. They've suggested caution over continuing to this liberalizing trend over telehealth regulation and payment. But Crossan says, many just think the genie's out of the bottle, that telehealth is really here to stay. And his post and the others in the package just raise a number of questions about how we're going to proceed.
Right. So I was thinking maybe for the rest of our time here today, we could do this David Letterman style. Like, ladies and gentlemen, tonight we have the top 10 unanswered questions about the future of telehealth.
Well, I like that. Although I'm afraid that after we explain to all the younger folks who David Letterman is, we might not have time for the top 10.
Okay. Why don't we start with 3? Here we go. Ladies and gentlemen, it's time for the top 3 unanswered questions about the future of telehealth.
Okay. Question number 1. If I remember from the home office in Sioux City, Iowa, or whatever it was, should Medicare continue payment parity for telehealth and in-person visits?
Great question, Chris. So one of our posts from an assistant professor at the University of Michigan, Chad Elemoto, he wrote in his post that there are several reasonable arguments against payment parity, right? One, relative to in-person care, it's plausible that telehealth requires less clinical effort. 2, care delivered by telehealth may have less value than in-person care, in the sense that it may be more likely to be ineffective or inefficient potentially. Other arguments are that telehealth may have a greater potential for overuse than in-person care. And finally, he notes that someone might argue that practice expenses associated with delivering telehealth may be lower than in-person care.
Well, that's right. But then he goes ahead actually and rejects these arguments. He says, for instance, that clinical effort for an outpatient visit is defined by factors that aren't really about the nature of the visit, whether it's in person, or telehealth, but things like the clinical effort is by the complexity of the patient's diagnosis, the volume of data reviewed, risk of management options, time spent in patient care. He talks about how the quality of care is not defined by the mode of delivery. High value care, low value care exists in telehealth and in-person visits alike. Third, he says that the evidence suggests that telehealth has served as a substitute for in-person care rather than adding new visits. And finally, telehealth doesn't always yield lower practice expenses compared to in-person care. There are sort of costs and savings in both areas.
Yeah, real murky case there, and a lot of questions still yet to be answered. Okay, here we go. Question number 2. What about the interaction between telehealth and payment reform?
First of all, there's some, as Crossan notes, people have talked about embedding telehealth payment in what are known as alternative payment models, an effort to get away from paying for volume, to get away from paying more for doing more, doing that as a way of mitigating the risk of overuse of telehealth. A good example that he talks about is this framework that's been proposed by the Alliance for Community Health Plans. And we'll put that and some of the other posts that we've talked about in the show notes so people can refer to them later. But the interaction also works the other way, as Amal Navathe and Josh Lau write in their blog post. Telehealth can enable us to pursue payment reform and care delivery reform more effectively.
Right. So an example of this might be implementing population health management tools. Often those efforts focus on a really narrow slice of the population because of limited resources. But maybe telehealth can vastly broaden the slice of the population that clinicians can reach with these tools.
Yeah. Well, and let's do one more question here. Question number 3. What are some of the other factors, policies, and maybe obstacles affecting the implementation of telehealth?
Great question, Chris. So one factor that we covered in our pages is physician licensure. The fact that it's done by individual states. So a physician that's licensed in one state is not necessarily licensed in another. And that could create an obstacle. I think we've seen it as an obstacle to conducting telehealth visits across state lines. And this was raised by Joseph Liss and co-authors who say that the solution is for states to mutually recognize each other's physician licenses.
This system works well for nurses too, they point out. There is an existing what's called an interstate medical licensure compact, which is sort of an attempt to make it easier for physicians to practice medicine across state borders. But according to our blog authors, at least, there's a lot of cumbersome procedures that are involved, and take up has been limited.
Right. So finally, before we wrap up, we should also note another policy obstacle. When the public health emergency is over, there's a risk that Medicare will revert to its pre-pandemic restrictions on paying for telehealth outside of those very specific rural areas and locations that you mentioned earlier. And this would obviously have a pretty serious impact on the future of telehealth if Medicare goes in the other direction.
Yeah, I mean, that's right. Kyle Thompson of the AMA, he wrote about this in his blog post, and he specifically urges Congress to remove this restriction for the long term and prevent Medicare beneficiaries from losing access to telehealth services at the end of the COVID public health emergency. I mean, that what had happened is that it had been waived during the public health emergency, but unless Congress acts, he points out, that waiver will expire and we'll go back to the restrictive environment that we were in before.
All right. Well, that was three big questions. I think that's probably a good place to stop. Chris, thanks for going on that thrilling journey with me. Obviously, we've raised the questions and the answers are still out there. And to some extent, we can continue the research and explore and debate and discuss them. And it will be interesting to see how everything unfolds in the months and really years ahead.
Definitely will be, and it's job security for us. And we would encourage listeners, if you like what you heard, subscribe wherever you get your podcast. And thanks for listening.
Thanks, everyone. Talk to you later, Chris.